Hi, I'm Dr. Aisha. I'm an ENT surgeon practicing at Excell-ENT clinic. Today I'm going to be breaking some myths regarding sinus headaches that most very commonly we see a lot of patients who come in saying that they have sinus headache, or they just say I've been diagnosed with sinus issues. But more often than not, those sinus headaches are usually migraine. They're misdiagnosed or improperly told to the patient that they are having sinus issues, whereas in fact they are actually having migraine. So migraines are basically half-sided headaches, pulsatile in nature, and very commonly or usually it's associated with nausea, vomiting. People are also very sensitive to light and bright sounds during those attacks. Usually migraine is triggered by certain situations or certain things that people do, like suppose if you've not slept well overnight and then you wake up in the morning and you develop a headache, or you haven't had proper meals, you're skipping your meals, especially breakfast. If you're skipping breakfast for a long period of time, and a lot of the time stress can cause, traveling can cause headaches for certain people. Then there's also, if especially for women, if they've washed their hair and they've not dried it well, for certain people the cold air sitting under the fan or an AC can. However, in sinus issues or sinus disorders as we call it, usually along with the headache you will also have fever, you will have purulent discharge from the nose, in the sense yellowish greenish sputum coming from the nose, and nasal nose block, and feeling of tiredness, like kind of like when you have a cold. So that's kind of what we would call as a sinus issue, not these half-sided headaches which are pulsatile in nature with nausea, vomiting. So if you or someone you know suffers from half-sided headaches without frequent fevers and runny nose with nasal discharge, more likely they are suffering from migraine headaches. And if you know someone who is really suffering, you can get in touch with us for further information and for the treatment.